Welcome back to the channel. Today, we're talking about something that affects millions of seniors across America, and almost nobody is warning them about it. We're talking about common, everyday medications that have been linked to memory loss, confusion, brain fog, and even increased risk of dementia. Now, let me be very clear from the start. I am not telling you to stop taking any medication. That decision belongs to you and your doctor. What I am doing is giving you information, solid, research-backed information, so you can have a smarter conversation with your healthcare provider, so you can ask the right questions, so you can advocate for yourself or for someone you love. Here's why this matters so much after age 60. As we get older, our liver and kidneys slow down. They don't process medications the way they used to. Drugs linger longer in the body, they cross into the brain more easily, and the brain itself becomes more sensitive to chemical interference. A medication that caused zero problems at age 45 might start clouding your thinking at 67. That's not a weakness, that's biology. The frightening part? Many people assume their forgetfulness is just normal aging, or worse, early Alzheimer's, when in reality, the fog lifts completely once the offending medication is adjusted or removed. So, let's go through 9 common medications that research has connected to memory problems in older adults. Some of these will surprise you. Number 1, and this is the big category, anticholinergic medications. Now, that's a complicated word, so let me break it down simply. Your brain uses a chemical messenger called acetylcholine. Think of it as the spark plug for memory and learning. Anticholinergic drugs block that chemical. They dampen it. And when you dampen the very substance your brain needs to form and retrieve memories, the result is predictable. Here's the alarming thing. Anticholinergic drugs are everywhere. They're in certain allergy medications like diphenhydramine, that's the active ingredient in Benadryl. They're in sleep aids sold over the counter. They're in some bladder control medications like oxybutynin prescribed for overactive bladder. They're even in certain antidepressants and muscle relaxants. A major study published in JAMA Internal Medicine followed over 3,000 older adults for years. Those who took anticholinergic drugs regularly had a significantly higher risk of developing dementia. The longer they used them, the greater the risk climbed. And here's what breaks my heart. Many seniors take diphenhydramine every single night to sleep, not realizing it's quietly working against their brain. They buy it at the drugstore without a second thought. It says sleep aid on the box. It feels harmless. If you're taking anything for allergies, sleep, or bladder issues, ask your pharmacist one simple question. Is this anticholinergic? That single question could protect your brain. Number 2, benzodiazepines. These are anti-anxiety and sleep medications. Names like diazepam, lorazepam, alprazolam. You might know them as Valium, Ativan, or Xanax. These drugs work by slowing brain activity. That's exactly why they calm anxiety and help you sleep. But in older adults, they slow brain activity too much, too broadly. Short-term memory crumbles, concentration vanishes, reaction times plummet, and long-term use, we're talking months or years, has been associated in multiple studies with increased dementia risk. A French study that tracked nearly 9,000 elderly participants found that those who started taking benzodiazepines had roughly a 50% higher risk of developing dementia within 15 years compared to those who never used them. The tricky part? These medications create physical dependence. You can't just stop them cold turkey. That's dangerous. But you can talk to your doctor about a slow, supervised taper, about alternatives, about cognitive behavioral therapy for insomnia, which research actually shows works better long-term than pills without any brain risk whatsoever. Number 3 might genuinely shock you. Statin medications for cholesterol. Atorvastatin, simvastatin, rosuvastatin. Millions of Americans over 60 take these daily. And yes, they can be important for heart health. But the FDA itself has acknowledged that statins can cause reversible cognitive side effects. Memory loss, confusion, fuzzy thinking. Not everyone experiences this. Many people take statins for decades with sharp minds, but a subset of patients and researchers are still working out exactly who experience noticeable mental cloudiness. The mechanism isn't fully understood, but one theory involves cholesterol itself. Your brain is roughly 60% fat. It needs cholesterol to maintain nerve cell membranes and produce certain neurotransmitters. When you aggressively lower cholesterol body-wide, the brain might feel the squeeze. If you started a statin and noticed your thinking becoming hazier within weeks or months, that's worth reporting to your doctor. There may be alternative cholesterol management strategies or a different statin that crosses less readily into the brain. Number 4. Some blood pressure medications, specifically beta blockers. Metoprolol, atenolol, propranolol. These are prescribed to tens of millions of older adults. Beta blockers work by blocking adrenaline receptors, which slows the heart and lowers pressure. But some of these drugs, particularly the ones that are fat-soluble, meaning they cross easily into brain tissue, can cause fatigue, depression, mental slowing, and memory complaints. Propranolol is especially known for this because it penetrates the brain so readily. If you're on a beta blocker and experiencing foggy thinking, ask your doctor whether switching to a water-soluble beta blocker or a different class of blood pressure medication entirely might preserve your mental clarity without sacrificing cardiovascular control. Your brain and your heart both deserve protection. They shouldn't have to compete. Number 5. Older generation antidepressants called tricyclics, amitriptyline, nortriptyline, doxepin. These were developed decades ago, and while newer antidepressants have largely replaced them for treating depression, tricyclics are still commonly prescribed for chronic pain, migraines, nerve pain, and insomnia in older adults. The problem? Many tricyclics are powerfully anticholinergic. Remember that memory blocking mechanism we talked about earlier. Amitriptyline is one of the strongest anticholinergic drugs in common use, and yet it's still prescribed to seniors for sleep or pain without adequate warning about cognitive effects. I've heard from viewers who said they felt like they were losing their minds, forgetting words mid-sentence, unable to follow conversations, and the cause turned out to be a low-dose tricyclic they'd been given for back pain. Once tapered off under medical supervision, clarity returned within weeks. If you take a tricycle, this doesn't mean you must stop immediately. It means you deserve a conversation about whether safer alternatives exist for your specific situation. Now, I want to pause here for a moment. If you're over 60, or if you're caring for an elderly parent, spouse, or loved one, this information could genuinely be life-changing, maybe even life-saving, because medication-induced cognitive decline is one of the most treatable causes of memory loss in older adults. Unlike Alzheimer's disease, it can often be reversed. So if this is resonating with you, do me a small favor. Hit that subscribe button so you don't miss future videos like this one. And if someone you love takes multiple medications, please share this video with them or with their family. Knowledge truly is protection. Let's continue. Number 6. Opioid painkillers, hydrocodone, oxycodone, tramadol, codeine, morphine. These are prescribed for moderate to severe pain, after surgery, for arthritis, for back injuries. And while they serve an important purpose in acute situations, long-term opioid use in older adults creates a thick cognitive fog. Opioids bind to receptors throughout the brain, including areas responsible for memory formation, attention, and executive function. Seniors on chronic opioids often describe feeling like they're thinking through cotton wool. Studies have shown measurable declines in memory testing among older adults on long-term opioid therapy. Some research even suggests chronic use may accelerate brain volume loss over time, actual shrinkage of brain tissue. The tragedy is that many seniors remain on opioids for years because nobody revisited whether they still needed them or whether physical therapy, nerve blocks, topical treatments, or non-opioid pain management could work instead. Pain is real. It deserves treatment. But your treatment shouldn't cost you your mind. Number 7. Anti-seizure medications, particularly when they're used off-label for nerve pain. Gabapentin and pregabalin, sold as Neurontin and Lyrica, fall into this category. These drugs have exploded in popularity over the last decade as doctors searched for alternatives to opioids. And for some patients, they work beautifully, but they carry well-documented cognitive side effects: drowsiness, confusion, difficulty concentrating, word-finding problems, and memory lapses. In seniors, whose brains are already more vulnerable to sedating effects, gabapentin in particular can mimic early dementia symptoms: dizziness, mental slowing, feeling drugged. Higher doses amplify this effect dramatically. One study found that older adults starting gabapentin had a notably higher rate of falls and cognitive complaints within the first few months. Falls alone are devastating for seniors. Broken hips, hospitalization, loss of independence. Add cognitive blunting on top, and you have a dangerous combination. If you're on gabapentin or pregabalin and struggling mentally, please bring it up at your next appointment. Dose reduction alone sometimes restores remarkable clarity. Number 8. Proton pump inhibitors or PPIs. Omeprazole, esomeprazole, pantoprazole. You probably know them as Prilosec, Nexium, or Protonix. These acid-reducing stomach medications are among the most widely used drugs on the planet. Originally intended for short-term use, 6 to 8 weeks, millions of seniors have taken them daily for years, even decades, for heartburn or acid reflux. Several large observational studies, including German research published in JAMA Neurology, found that regular PPI use in older adults was associated with a measurably increased risk of dementia. The proposed mechanism involves vitamin B12 depletion. PPIs interfere with B12 absorption, and B12 deficiency itself causes memory loss and nerve damage, as well as potential increases in amyloid plaque production in the brain. Now, the research is still evolving and not every study agrees. But given that many seniors take PPIs without clear ongoing need, the reasonable step is simple. Ask your doctor whether you still require acid suppression. Maybe dietary changes, elevating the head of your bed, or a less potent antacid could handle your symptoms without any brain risk at all. The stomach medication you barely think about might be worth thinking about carefully. Number 9. First-generation antihistamines. We touched on diphenhydramine earlier under anticholinergics, but this category deserves its own spotlight because of how casually these drugs are used. Diphenhydramine, chlorpheniramine, hydroxyzine, doxylamine. They're on cold medicine, they're in sleep aids, they're in allergy tablets, they're sold without prescription, and most people assume over-the-counter means perfectly safe for anyone. For a 65-year-old brain, these medications act almost like a mild anesthetic on the memory centers. The sedation isn't just drowsiness, it's a chemical suppression of the exact neurotransmitter your brain depends on for encoding new memories. The Harvard-affiliated study I mentioned earlier found that cumulative anticholinergic exposure, meaning the total amount taken over years, correlates directly with dementia risk. Taking diphenhydramine nightly for 3 years carries more risk than occasional use. The damage appears dose-dependent and time-dependent. Safer alternatives exist. Melatonin, cognitive behavioral therapy for insomnia. Second-generation antihistamines like cetirizine or loratadine for allergies, which don't cross into the brain as readily. Small substitutions can offer enormous protection over time. So, what should you actually do with all this information? Let me give you a clear, actionable plan. First, make a complete list of every medication you take, including over-the-counter drugs and supplements. Bring that list to your next doctor's appointment and say, "Can we review these together? I'm concerned about cognitive side effects." Second, never stop any medication abruptly without medical guidance. Some of the drugs we discussed, particularly benzodiazepines and opioids, require careful tapering to avoid dangerous withdrawal effects. Third, ask about the anticholinergic burden. Pharmacists can actually calculate your total anticholinergic load, the combined brain-blocking effect of all your medications together. Even if each individual drug has mild anticholinergic properties, stacking 3 or 4 of them multiplies the cognitive impact. Fourth, report any new mental cloudiness, word-finding difficulty, or memory changes that appeared after starting a medication. Your doctor may not connect the dots unless you speak up. Timing matters. If the fog began 3 weeks after a new prescription, that's a clue worth mentioning. Fifth, protect your brain through lifestyle. Regular walking, even 20 minutes daily, increases blood flow to memory centers. Social interaction, adequate sleep, Hydration. A Mediterranean-style diet rich in fish, olive oil, leafy greens, and berries. These foundations support your brain regardless of what medications you take. Let's bring this all together. 9 common medication categories: anticholinergics, benzodiazepines, statins, certain blood pressure drugs, tricyclic antidepressants, opioids, anti-seizure medications, proton pump inhibitors, and first-generation antihistamines have documented connections to memory problems in older adults. This does not mean every person taking these drugs will develop dementia. It means the risk exists, the research supports caution, and you have every right to ask questions about what you put into your body. The most important takeaway is this: medication-related memory loss is often reversible. Unlike neurodegenerative disease, which currently cannot be cured, cognitive decline caused by drug side effects can frequently be improved, sometimes dramatically, once the offending medication is identified and addressed. You are not powerless in this. Your voice matters in your healthcare. Your questions are not bothersome, they are essential. Your brain carried you through decades of life, raising children, building careers, navigating loss, celebrating joy. It holds every precious memory you've ever made. It deserves fierce protection now more than ever, so advocate for it. Question what you're told to swallow without explanation. Partner with a doctor who listens. And remember, forgetfulness after 60 is not always just aging. Sometimes it's a side effect with a solution. If this video helped you, please subscribe to this channel. We post new senior health content regularly, and I want to make sure you never miss something that could matter for your well-being. Share this video with a family member, a friend, a neighbor, anyone over 60 who takes daily medications. You might be handing them the one piece of information that changes their trajectory. And drop a comment below. Tell me, have you ever experienced brain fog from a medication? Did changing a prescription bring your clarity back? Your story might help someone else watching today who feels alone and afraid. Thank you for being here. Thank you for caring about your health. I'll see you in the next one. Take good care of yourself. You've earned it.